Can everybody hear me? Good morning. My name is Brian Huey, and I'm with the Tongan Community Service Center. Thank you all for joining the members of the Asian and Pacific Islander community who gathered today to express their outrage at the governor's proposal to cut critical services. California currently faces a $24.3 billion deficit and the possibility of running out of money by the end of the month. Dismissing solutions that raise revenue, the governor has chosen to propose to eliminate or to substantially reduce programs that serve Asians and Pacific Islanders across the state. Today we will hear from service providers, community members, and advocates who will be available for questions after our program. Our first speaker is Stuart Kuo, longtime leader of the Asian and Pacific Islander community and president and executive director of the Asian Pacific American Legal Center.
Thank you, Brian. Good morning, everyone.
Good morning.
We hope you like our new community room, and hopefully it will be the site of not only a lot of press conferences, but a lot of community meetings, which we look forward to hosting. I'm Stuart Kuo, President and Executive Director of the Asian Pacific American Legal Center, and we join all of you in the outrage at the proposed cuts to programs that serve our poor, serve our seniors, serve our children, and serve many Californians. We are outraged because there has been a lack of leadership in our state and has contributed mightily to the situation that we're in today. I want to just support all the efforts to raise our voices to make sure that people understand that by cutting these programs, we jeopardize the future of the people of the state of California. But we have to go beyond protest of individual programs because the system of governance, the system of budgeting, the system of taxation is broken in our state. I am also calling not only for protests for the cuts, but a renewed effort by all of our leaders to come together to look at the necessary reforms that our state needs to embark upon to make our state healthy once again. That will be a long path, but we need to look at what are the 4 or 5 or 6 major reforms in our budgeting, in our taxing, in our servicing of the poor in our state in order to have a healthy state. That will take a while, but once we are able to do that, we need to build a grand alliance of the Asian Pacific Americans and the African Americans and the Latinos and all the poor in the state of California. Our state is in jeopardy because we have allowed us to become more and more unequal. The gap between the rich and the poor, the disparities between the haves and have-nots is at such a level we need to speak out, we need to be thoughtful, and we need to build our grand alliance. Thank you very much, and I look forward to working with all of you to make our state healthy once again. Thank you.
Thank you, Stuart. Our second speaker is Paul, a community member with the Korean Resource Center and a participant of the Medi-Cal program.
Hi, my name is Paul. 저는 91년도에 미국에 왔다가 92년도에 교통사고가 되어서 코마 컨디션에 있었고 3개월을 지냈습니다. 그리고 그 후에 신경장애로 간질, 뇌출혈, 심장경색 또 그리고 많은 아픔이 있었지만 이곳은 하나님을 사랑하고 그 사랑을 받은 사람들이 하나님의 축복을 받아 세계를 이끄는 꿈이 있고 차별이 없는 나라에 살고 있다는 미국의 정신 하나가 저에게 용기가 되었습니다.
I came to the U.S. and I suffered a car accident. I came to the U.S. in 1991 and I suffered a car accident where I was in a coma for 3 months. After that accident, I became disabled and unable to work. I suffered from cerebral hemorrhage, cardiac blockages, and developed epilepsy due to the severity of my accident. However, I had always believed that America was a land that was filled with God's blessings and one without discrimination, and I tried my best to live, work, and be productive here.
93년 놀 시리즈 시즌 때 살고 있던 집이 무너져 내려 이틀 만에 깨어보니 온몸이 만신창이가 되었고 또 조난자로 판명이 되어서 FEMA로부터도 도움을 받았습니다.
In 1993, my house was destroyed in the Northridge earthquake. I woke up 2 days later with bruises and lacerations all over my body. I was able to receive some aid from FEMA as a victim of the earthquake.
그래도 저는 꿈을 버리지 않았고 꿋꿋이 계속 공부를 하였으나 너무 몸이 쇠진하여 20번 이상 쓰러졌고 그리고 응급으로 병원에 갔지만 눈물을 삼키며 다시 살려고 몸부림쳤습니다.
After those 2 major accidents, I did not give up hope, and I continued my studies. However, my body had received so much shock and duress that since then, I have lost consciousness due to epileptic fits over 20 times and have been taken to the emergency room.
그리고 7년 만에 신학을 졸업하고 일을 하려다 돈이 없고 아파도 병원에 갈 수가 없어서 침 치료를 받은 후 파상풍에 걸려서 130파운드였던 제가 210파운드가 되는 죽음만을 기다리는 사람이 되었습니다.
I finally graduated from theology school after 7 years, but as I did not have any money and I was uninsured, I could not afford to get treated, even though I was very sick. Instead, I tried an acupuncture therapy where I came down with tetanus. My whole body was infected, and from my normal weight of 130 pounds, I was bloated to 210 pounds from the poisoning, and I thought I was at my deathbed. The hospital wouldn't accept me because I did not have Medi-Cal or other insurance.
그 후 저는 메디칼을 신청했지만 2004년도에 LA 카운티로부터 거부를 당했고 결국 히어링을 신청하였고 2006년도에 스테이트 판사로부터 로스앤젤레스시의 판결이 부당하다고 메디칼을 신청한 날로부터 주어야 하며 그 외에 혜택도 주어야 한다는 판결문을 받아냈습니다. 이제는 내가 필요한 치료를 받고 있는 때입니다.
Afterwards, I applied for Medi-Cal in 2004 and was denied coverage from the county, but I requested a hearing and was able to overturn it. I finally have the Medi-Cal coverage that I need to treat my conditions. I have found a lifeline, and now I'm able to live with the consistent health care.
결론적으로 주정부에게 한 가지 제가 질문을 던져보겠습니다. 만약 당신의 가족이나 친구가 서류미비자라는 것 때문에 치료를 하여야 하는데도 신분의 문제로 혀를 깨물고 피를 토하고 온몸이 만신창이가 되어야 치료가 가능하다면 그것이 옳은 것이고 미국이 지향하는 미래이겠습니까? 또 미국인들이 그것이 잘된 일이라고 생각하며 주정부를 믿고 지지하겠습니까?
I want to ask one question of the governor and legislatures. Is it acceptable for your family members or friends to be denied access to medical treatment? Do you believe there should be cuts to critical programs like Medi-Cal, which provides aid to the most vulnerable?
또 미국인들이 그것을 잘된 일이라고 생각하며 앞으로 주정부를 믿고 더 지지하며 나가겠습니까? 연방정부의 법에도 저는 명시된 장애자의 의료 혜택을 줄인다는 것은 잘못된 일이라고 생각하고 또 주정부는 예산 부족이라는 명분하에 자신들의 잘못된 정책들을 투표권이 없는 힘없고 소외된 계층과 가족 또한 친구의 가슴에 엄청난 못을 받고 있다는 사실을 깨닫고 위험한 질주를 이제는 더 이상 하지 말아야 될 것을 간곡히 부탁드립니다.
The federal laws protecting the disabled are reducing medical benefits. The governor should not target those who cannot vote, are disabled, and need Medi-Cal benefits. These kinds of cuts impact the most needful community members. Would you endanger the health of your own friends and family? I sincerely request that you oppose these critical cuts to programs that are necessary to ensure the health and well-being of so many recipients.
Thank you, Paul. Our next speaker is Farhana Shahid, who is the lead community advocate for the South Asian Network's CHAI program.
Good morning, everyone. My name is Farhana Shahid. I'm working in South Asian Network as the lead community advocate. South Asian Network is a grassroots community-based organization in city of Artesia. For more than 5 years, I'm working in SAN, helping low-income South Asian communities in accessing health coverage like Medi-Cal, Healthy Families, Healthy Kids, and Kaiser Permanente programs, enrolling more than 2,000 families and over 500 seniors in different public benefits programs, including the most critical CAPI program. In this economic crisis, if the governor eliminates Healthy Families Children Health Coverage Program, and CAPI Cash Assistance Program for immigrants, our community will suffer severely. For example, it will greatly affect our seniors' ability to survive. It will make it difficult for them to make ends meet. It will promote violence, abuse, depression, dependency, isolation in the families. It will certainly snatch their source of living and then push them to darker future. It will leave an extremely negative impact on our children's health access. It will worsen living standard of our community because the majority of our community people they can't afford private health insurance. As a mother of 3 children who are also enrolled in Healthy Families program and being a community advocate, I believe the Healthy Families and CAPI programs are very necessary. If the government feels its sincere duty to protect our children and dreams of healthy kids and the seniors in the state of California, then it should save these programs at any cost. In closing, I would like to say that in this economic crisis, without these programs, all Asian immigrant community, including South Asians, will suffer heavily but by not having health coverage, in addition to possibility of going hungry and homeless. We strongly urge the government to take a wise decision and to continue these critical life-saving programs. Thank you.
Thank you, Farhana. Our next speaker is Ms. Lisa Yi, an in-home care provider with the In-Home Supportive Services Program.
Hello, my name is Lisa Yi. I speak Chinese. 我说的题目就是这些为国家做了一辈子工作的年长者。我的工作是37个小时，听起来不多也不少，但是需要照顾一个老人来说，远远不够的。我工作照顾一个老人是84岁的年长者，是退伍军人，就是 military his。他住在公寓，需要有人带他看病、做饭、搞清洁、买菜、洗澡等等等等。就在外出的时候吧，有一天我去到他家，看到他在地下躺着，完了脚是肿的。那我就问他，我说为什么不去看医生？他说的看医生需要预约。在我临走的时候，我就告诉他，我说要打电话给医生约一个时间。完了，出一份对长者的爱心。第二天从早上到晚上，我给他打电话，无人接听。这时候已是晚上8点钟了，就是我想可能他出事情了，我就驾着车到了他家。一进门看到他那个lie down的 floor， 那我就问他，我说为什么？他说的他脚肿了，一直全身痛不能移动，就是一天那个 overnight， no eat no drink nothing。我说后来我就想带他去医院，但是我已经扶不动他，因为他全身动不能动。我就给那个 call 911， 叫那个救护车来了，救护车人员把他送到医院的急诊室。那医生给他检查了一切，这时候已经是夜里凌晨3点钟了。那医生说可以带他回家了，我就跟医生讲，我说我是 I work to him，I can't 就是overnight。那医生最后没办法，就说的好吧，那就留他住医院吧，就把他留在医院了。在我到他家离开医院一共是9个小时。那我就是自己想啊，我说我已经没有那么多时间来就是给他工作了，我再下来我怎么办？那他还需要别人照顾他吗？后来第二天早上星期五呢，还要让我去接他出院，而且这一切费用，汽车啦，还有 gas 啦，所有的费用都是我自己来掏。那我就想，我说出在一个对老人爱心的有良心道德的心吧，那我最后没办法，只好还要帮助他。我想呢，如果我要不打电话问他，那这位长者不知道会出现什么后果。那最近听说加州政府在照顾年长者的服务上削减30%的薪水，我想这是一个很可怕的数字。如果薪水被削减，还有谁来关心这些那个年长者呢？ 难道州府想把这些年长者自然的灭亡吗？请大家来呼吁州长不要在年长者的身上动脑筋。难道州长斯瓦辛格的家里就没有年长者吗？请州长斯瓦辛格出来听听大众的呼声，赶快停止这个错误的而且不可想的想法。请大家来贡献一份爱心，救救这些年长者。
Good morning. My name is Hala Mazrim with the Asian Pacific American Legal Center, and I'm going to read Miss Yee's statement in English. Miss Yee is an in-home care provider with the In-Home Supportive Services program. There is an elderly gentleman I care for who was allotted just 72 hours of care a month. This may seem like a lot of hours, but it comes down to just 2 or 3 visits a week. My client is 84 years old and lives alone in an apartment. He needs help with personal hygiene, simple cooking and cleaning, taking him to the market, and accompaniment to doctor's visits. 2 weeks ago, when we were at the market, I noticed my client's foot and leg were swollen. I was concerned and advised him to make a doctor's appointment, but my client said not to worry. The next day, I tried calling my client throughout the day to check up on him, but he did not pick up. Finally, at 8:30 p.m., even though I was not scheduled to go, I drove to his apartment and found him lying on the floor, unable to stand. Immediately, I called 911 and he was rushed to the hospital. I can't imagine what would have happened if I hadn't stopped by. I was very concerned for my client, so I stayed with him until I had to leave about 9 hours later. The doctor wanted the client to go home, but I knew there was no one at home to look after him. So I asked the doctor to let him stay overnight, and I picked him up the next afternoon. I really wish I could have done more for my client. My hours with him are already very limited, and he has so many needs. Who knows what would have happened if I had not gone to see him that day? If there are more cuts, the elderly will suffer. Who is left to take care of them? The In-Home Supportive Services program is essential to the elderly in Los Angeles. Thank you.
Thank you, Ms. Yee. Our next speaker is Jury Candelario, Director of the Asian Pacific AIDS Intervention Team.
Good morning, everyone. I'm Jury Candelario, the Director of Asian Pacific AIDS Intervention Team. We provide prevention, treatment, research, and training services for Asian Pacific Islanders here in Los Angeles and in Orange County. As we speak, the legislature will be deciding the fate of critical services that are vital to Californians who are living with or at risk for HIV/AIDS. The governor's proposal would cut $80 million from the State Office of AIDS programs, cuts to HIV counseling and testing, epidemiology and surveillance, therapeutic monitoring program, home community-based care, prevention education services, and the life-saving AIDS drug assistance program. The proposed cuts jeopardizes California's ability to deliver life-saving medications to low-income people with HIV who cannot otherwise afford them. The AIDS Drug Assistance Program, for instance, provides treatment for nearly 35,000 low-income Californians. Cuts of this magnitude will increase morbidity and mortality from HIV and ultimately raise state costs as rates of HIV illness and infection rise. The additional cuts to the state HIV/AIDS budget will also cripple already underfunded local programs. California has served as a model for the nation and world for its response to the AIDS epidemic since the early 1980s. We understand that California is in an unparalleled budget crisis. However, we cannot solve California's economic crises by putting Californians with HIV/AIDS further in peril and imposing cuts that will result in the spread of HIV/AIDS. These cuts simply do not make sense. Cuts in AIDS funding will increase emergency room visits. Cuts in AIDS funding will threaten matching funds that we receive from the federal government. Cuts in AIDS funding is simply inhumane, short-sighted, and a threat to the community and public health. Cuts in AIDS funding equals death. We urge you to stand up and show the governor and our legislature, who are our public servants, that these cuts will simply not be tolerated. Stop the cuts, stop the bleeding, stop AIDS.
Thank you, Jury. Our next speaker is Nancy Scherer, who is a consumer of HIV/AIDS services and a Medi-Cal participant.
Hello, my name is Nancy Shear, and I'm a single mother living with HIV. I've also been diagnosed with multiple cervical and lumbar degenerative discs. I have slightly damaged nerves, neuropathy, and carpal tunnel. Living with these conditions make it extremely hard to do simple daily tasks. I'm on Medi-Cal, which doesn't cover specialists, so I have to rely on county hospitals to acquire help with my medical problem. I'm also living off SSI. Starting July 1st, due to budget cuts, I will only be receiving $850 a month. I have an 18-year-old daughter. She's right here, she's right there. Her name is Jessie. She's a full-time student, and with the economy, it's been hard for her to find a part-time job. So she relies on me financially. She says she's going to take care of me when I get old. But right now, I'm asking you to talk to your legislators to stop budget cuts. If they keep cutting us off, I won't be able to see my grandchildren grow up. Thank you.
Thank you, Nancy. Our final speaker is Helen Masri, State Policy Advocate with the Asian Pacific American Legal Center.
Good morning. My name is Helen Masri. I'm the State Policy Advocate here at APOLC, the Asian Pacific American Legal Center. Today you've heard about the governor's proposal to eliminate or reduce health services to millions of Californians, living assistance to immigrant seniors, drug assistance to the HIV/AIDS community, and in-home care to thousands of Asians and Pacific Islanders. These services are not only targeted for cuts currently, they have endured them for years as a result of California's broken budget process. In September of 2008, lawmakers passed a budget that included $11.4 billion in cuts. And then again in February of this year, they approved another $6.8 billion in cuts. Yet even after these drastic reductions, California's budget deficit not only persists, it continues to escalate. To resolve our crisis, new and effective solutions are needed to boost state revenue and also to infuse funds into our already suffering economy. Today, we call on state leaders to close tax loopholes that strip our state of desperately needed revenue and to stop tax cuts to wealthy corporations. Since September 2008, lawmakers have approved numerous tax breaks to corporations that will cost California $2 billion every year. As a result of this loss of revenue, struggling families will continue to be targeted by critical cuts to services. However, our state budget should and must reflect our priorities. How we care for our children and our seniors reflects our values as a state. As a result, California must address its revenue problem with revenue-based solutions. In addition to raising revenue, our budget process must be reformed so that Californians do not find themselves battling enormous deficit year after year. California must repeal its two-thirds majority vote requirement to both pass a budget and to raise revenue. We are the only state in the nation with such strict requirements, and these laws make efficient government impossible. Ultimately, long-term solutions will help to ensure that residents can regain control over budget decisions and avoid drawn-out budget battles. To preserve our state's safety net services, lawmakers must focus on solutions, not harmful cuts. They must make moral decisions that move California forward towards a healthy workforce, a productive communities, and a strong economy. Thank you.
Thank you, Hala. Thank you for joining us today to address the state's budget crisis. In coming weeks, community members and organizations will continue their efforts to advance budget solutions and protect safety services. Hundreds of letters have already been collected, and we invite you to a rally and press conference on Monday, June 22nd at 6 p.m. The flyer is included in your packets. We hope you'll be able to join us. This brings us to the conclusion of our program. Our speakers are now available for questions.
For the media representatives, we wanted to let you know that the Legal Center is hosting a book launch tomorrow on Asian American civil rights heroes. What time is it, Bernice? At 4:30 here at right in this location. Thank you.
I mean, you can sign it if you want.
그리고 그런 것을 계속적으로 뭐라 그럴까요? 해법이라고 가정대가 말하는 것 자체에 아무래도 이게 진짜 그 사람들이 아파보지 않은 사람이기 때문에 그런 거라고 생각합니다. 아니죠. 그 정도는 이제 제가 코마 컨디션이 있었잖아요. 코마도 있었지만 여기서 많은 그 뭐라 그럴까요? 이머전시 상황이 있었어요. 이머전시 상황이 있었지만은 여기 치료를 제대로 안 해준 거예요. 그렇죠. 신분 안에서. 그리고 메디컬 혜택도 거기서 내가 충분히 받을 수 있는 자격이 됐는데도 메디컬 혜택도 디나이를 했어요. 그거에 대해서 제가 항소를 해갖고 그거를 제가 LA 카운티로 이제 이겨갖고 받아냈는데도 거기서도 거짓말 시켰어요. 뭐라고 거짓말 시켰냐면은 너는 풀 커버리지를 받을 수 없다고 그랬는데 제가 알고 보니까 저는 풀 커버리지 있는 상황이었어요. 그런데도 또 거짓말을 시키고 그런 상황으로 계속적으로 이제 했기 때문에 제가 만약에 일찍 치료를 받았다면 더 나은 컨디션이 될 수가 있었는데 그런 거를 일찍 치료해주지 않고 계속적인 그 뭐라 그럴까요? 불법 체류자라든지 그런 불법 체류자 서류 미비자들에게 기회를 주지 않았기 때문에 만약에 더 큰 돈이 소비가 됐고 이것은 분명히 더 잘못된 정책이라고 생각해요. 왜냐하면 한 번에는 5,000불씩 들어가거든요. 제가 한 번 입원하면 5,000불, 6,000불이 들어가는데 계속 닥터를 받다면 200불, 300불밖에 안 되는 거예요.
그거 언제 몇 년도에?
그걸로 92년도에. 마흔불 아래로 볼 수가 있는 그런 해결할 수 있는 방법을 지금 주정부는 더 어려운 방법으로 해결하는 거거든요. 이것을 저는 복구할 수가 없고 또 한 가지가 지금 서류 미비자인 많은 형제자매들이 있는데 그 사람들이 지금 병원을 가지 못하고 있습니다. 주정부의 예산 삭감이라는 이유로서 많은 사람들이 지금 고통을 받고 있는데 그 고통에 대해서 그 고통은 그 한 사람의 고통이 아니고 가족의 고통이고 그 친구와의 고통이고 모든 사람의 고통이 될 수가 있는 것을 주정부는 생각을 해야겠습니다. 그리고 한 가지 물어볼 것은 아론도 슈가제네거가 만약에 당신이 그 장애자인 사람을 두고 있다면 자녀를 두고 있다면 만약에 부모로서 눈물을 흘리지 않고 이 법을 계속 상정할 수 있는지 한번 물어보고 싶습니다.